the doors of any hospital, one expects to find healthcare providers attending to the needs of patients and keeping family members informed about decisions made regarding their loved ones while delivering care with compassion and concern.
I'm Dr. Al-Sanadi. How are you?
You know, none of us can anticipate when the need will arise for us to turn to our healthcare system, yet we should be able to trust the hospital we choose to provide us with quality care when the time arrives. It is the obligation of all healthcare professionals to partner with patients and families to deliver that care safely and effectively and to earn that trust.
We'll walk with you through all of those. Okay. We appreciate you being here.
The number of medical errors continues to rise across the nation. Experts estimate each year more people die from medical errors than from car accidents, breast cancer, and AIDS combined. Imagine how you would feel if someone you loved was injured or even died because of a preventable medical error.
Well, we basically woke up on Christmas morning to a medical emergency.
Carla and Marvin DeJean of Coral Springs were outraged when their son Sebastian was given too much medicine while under the care of health professionals.
Well, by deduction, they could have only deduced that if he didn't get it anywhere else, the level of toxicity in his bloodstream could have only come from the level of medication that he received.
I felt very fragile. I felt violated, and I felt as if, you know, the 2 years that my son has been with us, that I had failed as his advocate and as his protector.
What angered the DeJean family even more was the hospital staff's insensitivity to them as people, as parents, and as experts on their child's needs.
I think that in my situation, I was made to feel like I was asking too many questions, as if I was maybe disrespecting the person I was dealing with.
You know, even though the hospital is in the business of saving lives and taking care of lives, it's sort of like you're also in the hospitality business. You know, at the end of the day, like Carla said, when we leave that hospital setting, we're going to gauge it on a star basis.
Sebastian DeJean suffered no long-lasting effects from this medical error, but it could have been avoided altogether if certain safety measures had been followed.
Even though we were distraught, but we're very thankful that you know, the situation wasn't something dire. Sebastian turned out to be just fine. However, we felt that strong enough about the situation, not only to bring it up, but to also stress that we wanted to share our story to make sure that this situation didn't occur to other families.
Hello, I'm Alan Levine. Our goal here at the North Broward Hospital District is to provide our patients and their families with quality care, complete information, and the tools to allow them to take an active role in their safety. Patient safety is always our first priority. Like any business, we realize customer service is a very important component to the success of our organization. Improving patient care and reducing medical errors is the responsibility of every employee and associate within our healthcare system. We must all work together to ensure medical mistakes do not happen on our watch.
Margaret, you okay?
I'm doing okay. Almost there.
That's good.
Oh, okay.
Terry, here's the door here. You can go in right here. You want to give
You'll
Mom
be all right,
a hug
Mom.
and kiss?
Okay. I love you.
Following a simple set of guidelines can lead to better, safer care with fewer mistakes. Before you lay hands on a patient, each and every time, explain what you plan to do. Positive patient identification is the first national patient safety goal and the first step in providing care safely.
What's your name?
Margaret Smith,
And your date of birth?
1341.
Okay.
Positive identification is imperative prior to any procedure, test, or administration of medication. And this means asking the patient to tell you his or her name, not asking him or her to verify it. Encourage patients and families to ask questions and really listen. You cannot afford to ignore or take lightly their need to know.
So we're going to go ahead and do a needle stick in the groin.
Okay.
Take a catheter up to your heart
Okay.
to take pictures of the vessels of the heart.
All right.
If there's any blockages, we'll usually take a little balloon and metal stent and open it up. Okay.
Take every opportunity to teach them and to learn from them. Open communication fosters partnering and will make errors less likely.
I think in order for the patient to feel comfortable speaking up, that practitioner has to open up the communication for that to happen and not to make the person feel like, okay, I know what I'm doing, step aside.
Had an okay night?
Yes, very good.
Any pain anywhere?
Nope.
Treat them with respect. Remember, we provide a service, and in doing so, we need to practice good customer relations. Ask patients and family members often if there's anything you can do to make them feel better or make them more comfortable. Inquire about any concerns regarding the plan of care. Maintaining a culture of patient satisfaction requires openness, kindness, and compassion. The Dijon family recalled one doctor who took time to sit down for just a moment to put their minds at ease.
That doctor stayed in our minds because he took the time to just simply sit, shake our hands, I think, sat down, explained everything, and then walked out.
Another national patient safety goal is to provide safe medications. Now, this involves living by the 5 rights: right patient, right medication, right dose, right route, and right time. Never hesitate to ask the prescribing physician to clarify an order or to consult the pharmacist with any questions if something doesn't feel right.
It's a PO dose, and I was kind of questioning it. It seemed a little high to me.
You may actually save a life just by speaking up.
So don't be condescending, but try to understand where the patient's coming from and just listen. Respond to the patient and realize that they're trying to help you too. They're trying to help you to help whoever is injured or whoever needs help. And they might say something that will save that person's life.
It is everyone's responsibility to immediately disclose any adverse event or mistake by reporting to a supervisor or through an occurrence variance report. Only when issues are in the open can breaks in the system be identified and repaired to prevent repeat occurrences.
Remember, you, the patient, and their loved ones are all partners in promoting patient safety. Unfortunately, mistakes can happen, but our patients trust us to do all we can to prevent them. It's what we learn from those mistakes that can make our healthcare system much stronger. The Dijon family graciously offered to share their experience with us so we can ensure the safest environment, the best customer service, and measurably excellent quality of care. Let's do our best to show that we all receive the message loud and clear.
Everybody wants the best for the patient involved, but what we stress is that the parents or the advocates should be part of that process.
The patient and the patient's family can either feel horrible or very, ill-treated, and then that marks their experience for the rest of the time they're there, or something can happen, something magical, and very easy, which I think is compassion, can happen that will set the tone for the rest of their stay or however long they need to be treated. And that will change the way that person feels for the entire time.
Having a balance would probably make you one very effective practitioner.
By identifying and analyzing potential and actual mistakes and finding solutions to systems failures, together we can reduce the number of medical errors. Working as a team that includes our patients, we can create a true culture of patient safety. Remember, we are all in healthcare to do our very best when our patients and our families need us most.